Hi everybody, my name is Ian Mason. I'm Director of Communications at Select, and I'm also chairing the Communications subgroup for the CICV Forum. Thanks very much for attending today. We've got a lot to get through, so I'm going to hand you over in a moment to Becky Crosland, who's the Health and Safety Advisor for BESA, and also heads up the Health and Safety subgroup for the CICV Forum. Today she's going to discuss with the launch of new guidance for restart imminent, what we need to do to return safely. Becky's presentation will take around 15 to 20 minutes, and then what she's going to do is run through questions that people submitted beforehand. So thank you to everybody who submitted your questions. If there's something that we don't cover, if you'd like to post it in the chat, or if you'd like to contact Becky afterwards or the CICV Forum, those details will be made available. So we've got a lot to get through, so I'll hand you over to Becky. Thank you very much.
Thank you, Ian. Good morning, everyone. I'm just going to show my screen now. Hopefully this will work. Can anybody see my screen? Ian, can you see my screen?
I can see it, yeah.
Excellent. So, to start with, the CICV subgroup has basically been producing some works to run alongside the safe operating procedures. Now, the Construction Scotland are due to release the safe operating procedures, a new version, later on this week, and the CICV Forum has produced some guidance that will run nicely alongside that, and it's sort of a how-to guide of how to comply, so giving you some further things to consider when you're opening up. The other thing the CICV subgroup is completing is further works for the smaller contractor. So things like animations and also risk assessments. It's really important that when we go back to site that we ensure that the works can be completed safely. And that's one of the things we've done. We've actually used these guidance notes to make sure that everybody's got some sort of an idea of how to start. A lot of the bigger sites will be doing their own guidance in relation to the SOPs, but we look forward to receiving both early this week. Moving forward, the government's plan for a phased return to construction starts with phase 1, which is planning, and this planning includes things like making sure that you've got measures in place to ensure you can comply with social distancing. So moving forward, if all goes to plan, from tomorrow, phase 1 will start, and that will include things like site managers, principal contractors going to site and making sure that the site is safe for people to return. Phase 2 will be COVID-19 pre-start site prep, so making sure that everything's in place and making sure that they can maintain that 2-metre social distancing, and looking at how big the site is. Each site will be different depending on how many people go to that site. Larger sites will have a harder job, I think, than smaller sites. Phase 3 is a soft start to site works, again, where physical distancing can be maintained, and that's that 2-metre distancing rule. And that soft start will probably start with things like very small numbers of construction workers coming to site. And gradually during phase 4, they're expecting those numbers to be introduced, again, still mindful of social distancing. Phase 5 will obviously include things like PPE, providing we've got, we can actually get that PPE and there is a good supply. The other thing phase 5 will rely on is ensuring that R number, the rate of infection, doesn't go up. So each phase that the government goes through will need to be approved by the government and the unions before starting. And this is purely just to look after your health and safety. It may seem onerous at the moment, but it is really just to protect your health and safety. And phase 6 will be increasing density and productivity with the experience we've got so far. but all the time looking at that R number and making sure that we can keep that down. One of the main things with the R number is to make sure it stays below about 0.7. If it goes above that, that could indicate that we have another peak in the virus, which nobody wants. In that respect, if there's another peak, we could probably expect that the government may consider things like regional lockdown. So in certain regions, if it's seen that the spike is a lot higher than others, then there's an option there to start looking at maybe we can lock down certain regions, but that hasn't been confirmed by the government. Going back to work, key messages. Well, the main one is that works requiring the 2 metre distance rule must not go ahead. I think it's about phase 4, phase 5, once agreed by the government and the unions, that we will gradually start to use RPE and PPE. There is a gradual return to work planned. So initially, the sites won't be full as they were before. They'll have small crews coming on site, and then they plan to gradually increase that, all the while keeping an eye on the R number to make sure that we're not having a spike. The First Minister has been very clear that evidence to require sites to start has to be produced, and it has to prove that the works can be completed safely without risk to workers, which again is looking after your health and safety. At the moment, if there are operations that cannot be undertaken without the parameters of social distancing, then what the government is saying that they can't take place until a specific risk assessment has been completed. At the moment, only absolutely essential work. So if there's a risk to life or property, then obviously if you're a gas fitter and there's a gas leak, you'll be allowed to do that. However, on site, things will be very different because a lot of works will be postponed until we get into that phase 4. This is all obviously in relation to what SOP is produced tomorrow. Now, the SOP produced by Construction Scotland will be hopefully released this week, and then we'll have further guidance on the measures we need to take. But obviously keeping that 2 metre distance and being socially safe is one of the most important things, and washing your hands as well, and also looking out for symptoms, any symptoms of COVID-19. Considerations when you're going back to work. So phase 1 will involve you to start thinking about site access and egress. So how are you going to get people in and out of the site? And along with this, think about things like fire evacuation. Obviously, in the event of a real fire, nobody's expecting people to keep to the 2 metre distance rule. However, once you all gather outside, it's a good point to start thinking about, is your original muster point sufficient? Can you get people to keep to that 2 metre distance rule? Some of the things I've seen happening are agreements with local parks, that maybe sites go into local parks because there's more room. So again, just looking at what you've got already and seeing if that's going to be sufficient. Site layout, so looking at the site layout, I've had lots of questions this week about, can we pass each other if it's only for a split second? That would be probably fine, providing everybody is okay and has no symptoms of COVID-19. However, you need to start looking at site layouts and seeing if you can implement a one-way system. I think we've all been to supermarkets recently, and they've helpfully put little arrows on the floor, but you always get people walking down the wrong side of the arrow or the wrong way, simply because they've forgotten something. So start thinking about similar systems. Welfare facilities, again, increased hygiene measures. There's been all sorts of different ideas and innovative ways of stopping the spread of COVID when using welfare facilities. One of the best ones, and obviously it would only be with finances that were available, is when you go to service stations. Some service stations now have the air pull toilet, where you put the seat down first and then you press a button. It uses a lot less water, but also reduces the risk massively of COVID-19. Start looking at logistics and operations. So how are you going to get materials and people and staff in and out of the site? And again, looking at systems that work for the drivers as well. We still have a legal responsibility to allow them to use the toilet. And there's been some stuff in the news this morning about delivery drivers being omitted from being allowed to use toilets simply because they may have COVID. There are ways to control that. And again, some drivers may need to use the toilet, obviously, to wash their hands as well. When you're looking at all of the above, the first thing you need to start thinking about is risk assessment. And on that risk assessment, again, try to look at tasks that traditionally would have involved 2 people. Try and find ways of doing that with just one, or maybe one guy goes in first and the second guy goes in after. But the social distancing recommendations need to be followed going forward. So the success of the return to work in Scotland will depend massively on, number one, the safe systems in place, so your risk assessments, your COVID controls, the management of those safe systems. In some instances, you will be a very small contractor going into domestic homes. In other instances, you may be a really big provider of construction services and have many subcontractors. So you need to start managing those systems. And very much as the diagram explains, that there's various ways to do this. It will affect productivity. I can't lie, it will make things a lot slower to begin with. However, have faith, because things will change. Going forward, the guidance, the recommendations, the regulations in place will be constantly monitored to make sure that they're still fit for purpose, if you like. The other big thing we need to watch out for is worker behaviour. So on some sites, they may have a COVID-19 ambassador or somebody that's just dealing with making sure people keep the social distancing guidelines. Certainly in England, I've had reports of guys that are so dedicated, and that they've had all the toolbox talks, and they're all raring to go. They get on site, and within 10 minutes of starting work, they simply forget. So not a terrible thing. They're just getting on with their job. However, could have big implications if we have anybody that may have the virus. So again, looking at those 3 things: the safe systems in place, management of those safe systems, so regular checks to make sure they're working, maybe employing a COVID-19 ambassador for all things COVID-19, and also watching out for worker behaviour. It will be different depending on the experience of that site worker. The age of the site worker will also come into play as well. So if you have any apprentices or anybody that's young, that's just started in the industry, again, be very mindful that they may not be, they may be more complacent than somebody that's been on site for a long time. Expect changes to the way you work. We all need to start thinking outside the box. So some works will have to be postponed if they involve working more than closer than 2 meters. If that is the case, it's time to start thinking outside the box, thinking of ways that perhaps you could continue with that task, but while maintaining the 2 meter social distancing rules. There's lots of advice and guidance on various government websites, the Scotland government website, but also if you're a plumber, then there'll be specific guidance on those particular websites as well. Temporary rules may in place regarding canteen and welfare arrangements to ensure that the 2 meter distance rule can be followed. Again, making sure that we keep the 2 meter distance is important, but ensuring that we follow the CDM regulations as well, which is legislation. So making sure that we do provide where required, but also making sure that we provide a means of cleaning equipment such as kettles after each use, which could be as simple as just providing bacterial wipes. However, as I said before, this process will need to be monitored because people get complacent. There'll be a lot of people out there, construction workers, that haven't had the virus. I've heard a lot of talk about this virus doesn't really exist because I haven't had it. Trust me, it really does. It's not going away anytime soon. And that is the reason for Construction Scotland and the Scottish Government's slow return to work. All of our behaviours will have to change. And as I said before, we'll have to start thinking outside the box. So thinking about different ways of doing tasks, And thinking about things such as, let's start at the beginning. Let's first check to see if all of our workers are safe. Let's check to make sure that none of our workers have any concerns. So again, making sure that you consult with your workers through every point of the process. It's not just up to the government, it's up to everybody that employs people. If you're a one-man band, then yes, you're on your own, but again, you need to consider all the guidance. The other thing to really consider is if you're a construction or somebody that provides building services and you cross borders, then you will need to make sure that if you're in Scotland, you follow the Scotland's advice, Scottish Government's advice, sorry, and if you're in England again, follow their advice. Through it all, again, the three main controls are washing your hands regularly, keeping that 2 meters social distancing, and obviously staying at home if you have any symptoms. And one of the new symptoms that we've been advised of is loss of sense of smell or taste. Now, it's really quite important, this symptom, because we've been informed that medically it's one of the symptoms that appears first. So it's a good indicator of an early sign of the virus, which may help to prevent the spread. So if you notice anything like that, again, good systems in place to make sure people are aware of what they've got to report. So there is a new social distancing regulation in Scotland following royal assent of the UK coronavirus bill. The Scotland regulation came into force on the 26th of March and was approved by the Scottish Parliament on the 1st of April. The key points are that the Scottish Government has introduced this regulation to ensure your safety, but it has to be reviewed every 21 days. The regulations will actually be reviewed every 3 weeks and will be kept on continual review by the Scottish Government. So they're continually looking at if this is necessary. It's a temporary social distancing regulation. However, it is enforceable in work. So the reason it was evolved was to make sure that employers that blatantly disregard the 2 meter social distancing rule can be taken to task. So basically, businesses that don't enforce this could be fined or ultimately prosecuted. The other things that could happen, you could have prohibition notices, which require some or all of your site to shut. And from what I'm hearing from the HSE, these will be enforced. We've also got to be mindful of whistleblowing. So anybody that's not convinced that they're safe may very well report the site. So it's about site managers, site owners, principal contractors, all looking at what they do and making sure they're complying with the latest government safe operating procedures, but also the latest government advice as well. Most of the advice is produced through looking at the medical evidence that we've got. And as I've said before, this medical evidence is subject to change. So bear with the government, because it may be that we need to make small changes to the guidance as we get further information, well, as it arises, really. But making sure that we comply and we basically have this regulation. It's actually embedded, will be embedded in the SOPs. So make sure that you comply, otherwise you could be ultimately fined if you don't. With face coverings, there's been a lot in the news about face coverings, and the First Minister actually recommended that face coverings could be very helpful in preventing the spread of COVID-19, especially on public transport and other crowded places. However, cloth face coverings are not respirators and they're not disposable protection from coronavirus. They won't protect people from the virus itself. However, they will help stop the spread of the virus through stopping those droplets coming out. They're only intended really for that purpose, to stop those droplets being spread. However, medical evidence shows that some droplets will go through. So cloth face coverings are really good if you're going on public transport, and there's likely to be a chance you can't maintain that 2 meter social distancing. However, together with that, we need to make sure that people that are sick, that know they're sick, do not attend work. And as a site manager or as a one-man band, somebody that hires contractors, starting at the beginning is probably the best place to start. So making sure that we have questionnaires in place to check Even daily, some people are doing this to make sure that people feel well, that nobody in their household is unwell. If that questionnaire flags up that somebody isn't well or a member of the household isn't well, then again, appropriate action can be taken really early. Medical evidence shows there is some evidence to indicate that in a small way, face coverings can help slow the spread of the virus, and we've seen that through other countries, but it also helps amongst asymptomatic individuals. So these are people that don't actually show any signs of the virus. Wearing face coverings, again, it's a personal choice, and I think if somebody wants to wear a face covering for whatever reason, then the employer should support themselves in doing that. It's important to make sure that face coverings are, if they're homemade, are actually effective. So in no way should they restrict your breathing. Another thing to be very mindful of is deaf workers. So if anybody is deaf and everybody starts wearing face coverings, it may be very difficult for that person to read what people are saying. So going forward, the CICV Forum are looking at that, and then we're looking at ways that we can get around that. But it's worth considering if you're in a group and you know that you have somebody that is deaf within your working task group. As I said before, wearing face coverings, there's lots of advice and guidance out there on face coverings, how to make them. Just make sure that you're not doing what I've read in the news recently, which is using dirty vacuum cleaner filters, fiberglass. There's all manner of different things. Be mindful, this is something you're putting on your face. The other thing that needs to be said is that if you're using a face covering, it's really important when you're taking it on and taking it off that you don't actually spread the virus that may be on the front of the face covering. So again, some good advice and guidance. I will post something on the CICV website of things to consider when wearing face coverings. But look at all the advice and guidance that's out there and make your own choice. As I said, it may help prevent the spread, but when we're looking at construction, we're asking anybody that's ill to stay home, and that's one of the most important messages. If people that are ill come out, the chances of everybody, even if everybody's wearing face coverings, the virus would still be able to be spread. So if you're sick, please stay at home. Considerations for use of cloth face coverings, they should ideally go over the nose and below the mouth. We've all seen people on the news recently with it covering their mouth and not over their nose. It should fit snugly but comfortably against the sides of the face, and as I said before, should in no way restrict your breathing. Be secured with ties or ear loops, and again, they need to be comfortable if people are going to be wearing these for periods of time. Best if they include multiple layers of fabric where possible, and masks should be able to be laundered if they're reusable. If they're not reusable, obviously disposed of in the right way. Again, massive consideration needs to be given to, if say for instance you're wearing a cloth face covering to work but taking it off at work, then you need to give consideration to where you're going to store that face covering so you don't reinfect yourself with anything that could be on the outside. Very personal choice. As I said, there is evidence to suggest they can help slow the spread of the virus. But again, if you're sick, stay at home. Industry news, there's new symptom out, loss of sense and or smell, sense of smell, sorry. Check your risk assessments if you've already done them, toolbox talks, and add these symptoms. Make sure if you've got any check sheets, medical check sheets, that these symptoms are added. As I said before, it indicates, medical evidence indicates this is one of the first symptoms that we need to be aware of, which makes it very important, because if we get somebody at the first stages, then we can stop them infecting anybody else. Some sites are looking into thermal cameras, so you may see those on site. Again, they have limited use, but they can detect somebody with a higher temperature in a crowd and can weed them out, if you like, and stop them attending site. And there are also close working warning systems that are being considered. And these can be worn as sort of an ankle bracelet or a vibrate warning when workers, they'll basically vibrate if workers are about to breach the 2-metre distance rule. But again, it will depend on the size of contractor and also whether the funds are available for that. Moving forward, I think to start with, we have phase 1, which will be looking at the sites and looking at how you can put measures into place so that people can come back to work safely and maintain that 2-metre distance rule. The other thing we need to be closely looking at is risk assessments. I've had a lot of questions about risk assessments. It's really very simple. If you have original RAMs that you've been working to before COVID-19, then you would just add the COVID-19 controls to that original RAMs. Again, important that you ask your staff their opinion. You can't just put risk assessments into place and expect people to comply. There's been a lot of good ideas from site staff that are working out that they're actually on the ground. And some ideas have actually been taken up by site managers and principal contractors. The reason being, if it helps everybody work safely, then everybody's interested. But make sure you have those toolbox talks. Another thing to consider when we run into phase 2 will be making sure that staff are wanting to come back to work, so getting their confidence, if you like. The only way you'll get their confidence is with a good risk assessment and a good explanation of the different controls in place where they're working. If you're on site and you consider that somebody is blatantly not following the 2-metre distance rule and you feel unsafe, then you would need to report that to the HSE, who I've heard reliably, I've been reliably informed, will be starting inspections and making sure that people adhere to that 2-metre distance rule. As I said at the beginning of the presentation, moving forward, each stage will need to be agreed by the government, Construction Scotland, and also the unions. This is simply to make sure that everybody's safe. As I said before, it might be very onerous waiting for construction to start, but I think in the long run, we all want it to start safely. This may have an impact on productivity to start with, but moving forward, as I said, if we have this R number, if this R number goes up, then again we will be forced to do another lockdown as we've done previous to make sure that that's not allowed to spread any further. So moving forward, I think we're going to move forward onto questions now. But if everybody follows the Construction Scotland SOPs that are due to be released later this week, and also the CICV underpinning guidance, there's a lot of good information. With the CICV guidance, it's sort of a how-to guide. So once we get the SOPs tomorrow, this guide shows you very clearly the things you should be considering. And again, moving forward, obviously this might change, so be aware that there might be changes. It may be we start working to the closer than 2 meters sooner than we think. It may be that it's longer than we think, but it will all depend on that R number, which is vitally important because that will indicate whether we're having a spike in the virus and whether we need to protect people further. So I think that's the end of the slideshow. I do believe we've got some questions.
Yeah, thanks, Becky. So thanks to everyone who sent in their questions before today's webinar. And I know we've had a couple of questions submitted while Becky's been speaking, and we'll try to get to those at the end of today's list. What I would say is that if you have any follow-up questions, or if your question isn't answered today, if you want to contact either the CICV Forum or the email address that you got through your registration, and we should be able to follow up with any other queries that you have today. So as far as questions go, the first one, Becky, is what are the main guidance documents from government and industry that we should be using for writing RAMs and doing inspections, etc.?
Okay, the main government RAMs would be the Construction Scotland SOP and any other guidance that's issued in conjunction with that by Construction Scotland, but also the CICV guidance will be a great help. We do have to comply with the safe operating procedures that will be produced shortly by Construction Scotland and the government. However, you will have to think outside the box, so to speak. So you will have to look at things and ways of getting around that, I think, moving forward. So Construction Scotland, sorry, safe operating procedures. And also look out for if you are a particular trade, so if you're a gas safe engineer or a plumber, there is other guidance out there as well, produced by the various associations for that.
Thanks, Becky. And question number 2, what are the typical operational procedures for construction sites post COVID-19?
So the main thing we need to be mindful of is starting with the main 6-phase plan. So phase 1 will be marking out your sites and making sure you've done a risk assessment, and start to look at the different trades that you can bring back while maintaining that 2-meter social distancing rule. So looking at altering sites, so that everything can be encompassed. Thinking about things like toilets and canteen areas, and also those tasks that may not be able to be completed. So on smaller sites, it may be possible to actually write a list of those things that will not be able to go ahead currently, but hopefully in the future we'll be able to proceed.
Okay. Next question was, where can we find more clarity for Construction United Kingdom?
There is a version 4 of the England SOPs that are out now, and also there's various other guidance on the different trade sites. The SOPs have been produced in conjunction with some government advice and guidance, which is on the site. If you look quite closely at the guidance concerning construction, certainly there's lots of areas that you can use to basically formulate a risk assessment. But again, if anybody has any specific issues regarding the United Kingdom, if they listen to the BISA webinars, but also feel free to email me direct on that question should you have a particular issue regarding the United Kingdom SOPs.
Thanks, Becky. Next question, where do we find more specific RAMs for Construction United Kingdom?
So it's the same RAMs as before, with the addition of the COVID-19 risk areas. So again, if you're looking, if you can use the RAMs you used before, but you will have to consider COVID-19. So look within that risk assessment for areas that will come into play. So if you're working closer than 2-meter distance, you need to start looking at those RAMs and seeing what procedures and controls you're going to put in place. The controls in England will be very different from the ones in Scotland, simply because in England they are working closer than 2 meters in some situations, and obviously putting further controls into place. So basically the same RAMs as before, but with the addition of the COVID-19 risk areas would be fine.
Okay. Next question is, if an employee shows symptoms, do all staff need to isolate? And this has come from a small team. So if other workers have had close contact with the person who is showing symptoms, must the other workers then isolate for 14 days?
Right, so if you have a confirmed case, and obviously that would mean they've had a test and it's identified within your workplace, you would contact first the Health Scotland Protection would provide the relevant staff with advice. General considerations, any employee in close face-to-face contact or touching contact with that person, if you've been talking to or they've coughed on you for any length of time, anyone who has been cleaning up body fluids, sick, anything like that. If you have a close friendship with that person, or you're working in very close work groups, or any employee living in the same household as the confirmed case, in that instance, those who have had close contact, which I've just explained, will be asked to stay at home for 14 days from the last time they had contact with that confirmed case. Excuse me, and they would follow the home isolation checklist as well. So obviously the Scottish Government would do some contact tracing there. If one person on the site who has not had close contact with anybody, because the 2 meter social distance rule has been followed, is identified, then there would be no point in sending the whole site home. So it would depend on the situation, the group that's working, and how close that contact has been. in relation to that question. But if anybody does show symptoms and you've been in a close group, then they would isolate for 7 days and you would isolate for 14 days.
Okay, thanks, Becky. The next question is, does the Scottish Health and Safety Executive have any specific guidance for working in domestic homes for trades such as plumbers and gas fitters, etc.?
Now, there is general advice surrounding this issue on the HSE website, but I've done some research, and the Gas Safe Register site for gas engineers has some really good advice on working on people's homes. And we also have the Scottish and Northern Ireland Plumbing Employers Federation, which is SNPEF. We have their webpage. We're going to share all of these web pages afterwards. They have some very good local advice, and again, thinking outside the box, so using that advice but applying it to your own particular situation. And we also have the CICV website, which again has some really useful links, but also further guidance on how we're going to do this. I think everybody has to look at their own situation as an individual. Depending if you're a one-man band or a big site, or perhaps just run an employee group of 10, everybody's situation will be different. So obviously make sure that you're complying with the government guidance, construction leadership, safe operating procedures. Again, is guidance, but it's there to help you. And obviously go to your if you're a plumber, go to the Plumbing Federation website where there'll be more specific advice for you.
Okay, thanks, Becky. If I can just add to that, what I would say is that the CICV Forum, if you don't already know, is made up of nearly 40 professional organisations, including trade bodies and trade associations. If you're not a member of a trade association, I would suggest looking into becoming a member or looking into that, because the range of information that's being offered, as Becky says, by each individual trade association is extensive and it's in depth. So I would ask you to kind of investigate that if you can. Next question. We have various jobs where we can easily have physical distance. Does that mean we can return to work on this basis?
Absolutely, as long as you maintain the social distancing rule. And again, remember that there is that regulation to enforce the social distance at work. Be warned, there's not just other construction operatives that will report you, but members of the public will as well. People have taken on the advice and guidance they've been given by the government. There has been a lot of scaremongering from the press, which hasn't improved things, but people are aware of how dangerous this virus is. It reminds me very much of asbestos, where you can't see it, so people become very complacent and you don't find out the results until 40 years down the line. However, with the virus, it's likely to be between 14 and 28 days down the line. And from what I've seen on the news, yes, some people are affected very mildly. In some cases, people don't even know they've had the virus. But in other cases, and we've all seen the death rates, there is a very high death rate on this virus. So just because you can't see it doesn't mean it's not there. We ask that everybody that is sick stays at home. But again, it's reasonable to suspect that not everybody will. There'll be various reasons. I have to feed my family. I don't want to lose my job. But all I can stress is, if you do think you've got any symptoms of the virus, then you need to stay at home. But as long as you can maintain the social distancing rule, and the site that you're working on, you obviously amalgamate what your controls are with theirs, then I think that would be fine to go back to work.
Okay, thanks, Becky. The next question is a two-parter. First part, what PPE should we issue to our employees? And the second part, is hand sanitizer acceptable if hand wash facilities aren't available on a domestic site?
So absolutely, I'll answer the first one, the second one first. Hand sanitizer is perfectly acceptable. It has to have an above 60% alcohol content. And should be used regularly. Obviously, if you've touched any at-risk points, then that is totally fine. What I will say about hand sanitizer is, although it's rare, just watch out for dermatitis. So again, part of your toolbox talks could include making sure that nobody has any bleeding hands from where they've been washing their hands every 20 minutes, or using hand sanitizer. So just keep an eye on that and make sure it's one of your checks. So the next one was, what PPE should we issue to employees? RPE and PPE, it's not really recommended in respect to protect yourself from the virus. However, I will say that if the risk assessment for a particular task says you've got to wear RPE or PPE, so if you're cutting stone or working with asbestos or welding, then that particular RPE or PPE must still be worn as dictated by your risk assessment, providing again that you can make sure you keep that 2-meter distance rule. So if you normally use PPE or RPE for your job, it will be the same. But it's not recommended for use to protect against coronavirus. As I already said in the presentation, there's very limited protection from face coverings. However, they will protect somewhat against asymptomatic individuals. And bearing in mind, close working is not permitted until phase 4 of the government plan has been reached and agreed by the unions, as well as the government and Construction Scotland.
Okay, thanks, Becky. I think you might have covered this one already in your presentation earlier, but is there any guidance or clarity on face coverings or fit tested RPE for COVID-19 last resort PPE?
So if you're involved in a task, for instance, where you had to go to somebody's home in Scotland because they had a gas leak, then you would wear all the PPE and RPE that is recommended on the Gas Safe website. Again, that risk will go up depending on where you're working. If you have somebody that has got suspected symptoms, we've had this twice where somebody's had to go into a hospital ward. However, the risk was still really low because that person was isolated. You would need to use the correct PPE and RPE, but that would only be for absolutely essential works, not for normal use. And we all know there's a current shortage of PPE and RPE. The other thing to be mindful of is if you can't get hold of your usual RPE, respiratory protective equipment, and you have to, say, change your supplier, for instance, and you get your masks, you will require a re-face fit test. Just because you have a medium in a Sunstrom that you've never used before doesn't mean that the face fit test for your last RPE will apply. So a new face fit test will be required. So really, no PPE or RPE on site currently until we're on phase 4. However, for those absolutely essential jobs where a life may be at risk, or there's a risk of damage to property and so on, then you would be permitted to continue as normal, but making sure you wear the correct RPE and PPE. BETA have produced a guidance note which is specifically for working in clinical environments. So maybe a domestic environment where somebody's perhaps shielding or has a suspected case of coronavirus. Again, you would follow the guidance within that particular guidance note, but it would only at the moment in Scotland be for essential works.
Okay, great stuff. Thanks, Becky. Next question. Would operatives have to wear face masks when working outside the 2-meter government COVID-19 guidelines?
So if they're working outside the 2-meter government guidelines, I would suspect that means if they've got to work closer than the 2-meter guidelines, then no, they shouldn't, unless it's an essential job, and then obviously follow the guidance that's been issued. If they do have to do that initially, they should do a risk assessment to make sure that the work actually needs to be completed in the first place, or if it can be completed another way. If the works is just a general nature, then again, as I've said before, we'll have to wait until stage 4 of the government plan to be permitted to use RPE and PPE. However, on a normal site, a normal day, RPE is not recommended. I don't know if anybody, I would imagine quite a few people on this webinar have used an FFP3 reusable mask, it would be very difficult to wear that for 8 hours a day. We've all seen the photos from the medical staff. To just do normal site activities would be almost impossible. The two main controls are washing your hands, three main controls: staying at home if you're sick, and also making sure that you maintain that 2-metre distance. So first do a risk assessment and then consider your options from that point forward.
Thanks, Becky. The next one kind of is a continuation of that one, I think. Should we be asking employees to wear face coverings at all times, not just whilst on public transport or in shops? Okay,
when you're looking at working on site or working in different buildings, working in someone's home, the first thing you would need to consider is if you're working in someone's home, what they require. In some instances, homeowners are asking any tradesman to wear some sort of face covering to protect them. That's totally fine, and you can say, yep, absolutely no problems, as and when required. Face coverings have been recommended by the Scottish Government for areas such as public transport and other crowded areas such as shops where you can't maintain that 2-metre distance. And that's simply because current guidance says if you're sick, you shouldn't be out. So the only thing we're looking out for is people who may not know they already have symptoms, or asymptomatic individuals, so people not showing symptoms. And in that respect, face coverings can be very useful. As for asking employees to wear face coverings, again, that you need to be very mindful that in some instances people won't be able to wear them because they have hay fever, for instance, and it restricts their breathing. And you need to consider the other hazards and risks of people taking them on and taking them off, putting them down on dirty tables. But ultimately, the government's advice is that if you're in a crowded place, then face coverings can be useful. They will not protect you from the virus. We know that already. We know there's limited evidence to say they may help stop the spread, but they won't protect you from it. The virus particles are smaller than the holes in your mask, and therefore will go through. So a combination of doing a risk assessment with your staff, a medical questionnaire with your staff, regular toolbox to remind them of the issues that they may face and the symptoms, and supporting them if they want to wear face coverings. Again, be very careful with face coverings. If you have any deaf workers, this prevents them seeing the expressions on people's faces, and there's been some extensive research done, and there's been a lot of news reports from people that do have a problem if they're hard of hearing or are in fact deaf, that they can't see the expressions on people's faces, and it makes it very, very difficult to communicate. So bearing that in mind. The other thing I've noticed on the different places I've been is when somebody's wearing a face mask, it's quite difficult to hear what they're saying. So if they're wearing a covering, such as a scarf, it sort of muffles what they're saying. So this could be an issue when we're looking at safety instructions. And you know, if somebody's giving a toolbox talk, it's really important that people get the information they're giving. The other thing to be mindful of is that we have a lot of workers that English isn't their first language. So again, making sure that you can be clearly heard through your face covering is really, really important. But it would be up to the employees. If employees want to wear them, I'm totally behind that. If employees don't, again, it's their choice. It's up to them.
Okay, thanks, Becky. I'm just conscious of time. We've got 10 minutes left, and I think we've got 5 questions, but I think we can do it. I think we can fit them in. The next one, how do we make sure site toilets comply? Do we need to deep clean toilets that are used on sites, such as in a community space?
Yep. So basically you need, on very large sites, they're going to need some sort of attendant to make sure people adhere to the social distancing rules. Some of the other things are that the toilet seat needs to be closed when people flush, because the flush can, obviously, we've all seen the adverts with the toothbrush where the flush of the toilet pushes up lots of nasty stuff from the toilet, COVID-19 aside. So making toilets shut. The other things people are looking at, I don't know if anybody's, most people have probably been up and down the motorway. They've seen the new toilets that are there. They're air sort of suction toilets. So you put the lid down first, you press a button, and there's sort of an airflow that sucks any waste out. They're also being looked at because, again, they stop the spread of the virus, obviously, because the toilet seat has to be down first. Increasing cleaning regimes, so making sure that you clean on a much more regular basis, providing hand wipes and things for people, and making sure there's adequate soap, hot water, and disposable towels. The other thing to remember is providing hand drying facilities, if they are paper towels, to make sure that that waste is disposed of correctly as well.
Okay, thanks, Peggy. I suspect that the answer to the next question will be updated when the guidance comes out later this week. It says current guidance on working within 2 meters is limited. What if the task is critical for the build to progress and would stop otherwise?
Right, bearing in mind we've got new guidance coming out this week with the SOP, Construction Scotland SOP. The current guidance I'm going by is that working within 2 meters is not limited, it's not permitted any closer than 2 meters, sorry. If the task is critical for the build to progress, i.e. there would be an explosion or something, somewhat of an emergency, then I would imagine you'll be allowed to continue. However, I did say at the beginning this may affect productivity, and it's about sites working with the government. So when the new SOPs are released and we finally start back at work, it's very important that you feed back any issues calmly, so that we can look at the guidance again and see where perhaps we can feed that back to the government. It's going to be difficult to start with, but I don't think it would simply be a case of whether it's critical for the build to progress. It would be, at the moment, if it's essential, so if there would be a problem, and it would create some sort of an emergency, unless the SOP dictates otherwise. I can't see that being changed for the time being. However, we may reach phase 4 quicker than we expect, just by safe working of sites as they start to go back to work.
Great stuff, thank you. The next question is about face masks again, Becky. Will wearers be required to be face fit tested as per normal requirements, or is COVID-19 a special case?
I would love to say COVID-19 is a special case. Nothing is a special case where face fit testing is concerned. What I'd like to say is if anybody has any particular face fit testing queries relating to their particular mask or masks they've used in the past, these can be directed to BSIF. They run the Fit to Fit tested tester scheme, which makes sure that every fit tester tests in the same way. If you change your mask to one that you normally wear, as I've said before, you'll need a new face fit test. If you're asked to wear FFP2, FFP3, any tight fitting RPE, then you will need a face fit test regardless of COVID-19. The reason we have a face fit test is to tell us how well the mask's performing in relation to the task we're doing and what we're breathing in. There's a taste test, a taste and smell test, but there's also another test which uses a machine, and it's vitally important that you get a face fit test. The other thing to consider as well is if you're wearing a mask in relation to anything, you would need to be clean shaven. Tight fitting RPE will not work effectively if you're not clean shaven. So again, making sure that if you do decide to keep any part of your beard or moustache, that it comes within the realms of what will fit inside that mask. There is a really good animation on the HSE website that shows the effects of facial hair and how it affects the workings of the mask. So if you're going to wear one, make sure you're face fit tested, and make sure you're face fit tested for your particular chosen mask and size of mask as well.
Okay, thanks, Peggy. I'll shave off my beard after this webinar. Second to last question. Can people walk past colleagues closer than 2 meters and just turn their head to the side when they walk past them?
Okay, at the moment in England, this is allowed. Again, if it's very, very fleeting, then the risk is thought to be quite low in conjunction with risk assessment, people only attending work. However, I would need to research this further because obviously we have the 2 meter social distancing rule. One of the ways to get round that would be to obviously have a one-way system. Now, I understand that that's not it's not practical in all situations. So again, I'll do some further advice on that, but I would advise, and I'm not a medical expert, but from the medical evidence I've read, a brief walking past somebody providing their well would produce no greater risk. However, in relation to the government, Scotland's 2 metre distance rule regulation, I would prefer to double check that and make sure that's okay.
Okay. Thanks, Becky. Last question today. I know we're nearly out of time. I think this one will probably refer to the first slide of your presentation, Becky. The phased return plan shown today is different to that issued in the government's letter to Construction Scotland, and means works can't start within the first phase of the government's roadmap. Which one should we be working to? And that's a live question that's today.
Okay, the live, thank you for that live question. Marvellous that you had the time. And as I said before, we value all questions. What we would need to do is follow the current SOP, which is due to be released this week. So making sure that we adhere to that where we can. That's all I can say at the moment on that.
Okay, thanks, Becky. That's all of our questions today, and that concludes our presentation. As mentioned before, if you look in the chat section of the webinar, you'll find some links that were mentioned during today's webinar. Also, you can email the CICV Forum if you have any follow-up questions, and we'll do our best to come back and update you as quickly as possible. What I would also say is that, as Becky has mentioned, guidance is due this week. As soon as it becomes available, we will let you know via the CICV Forum and via your individual trade association. So keep your eyes peeled on social media and on the websites, and you will get the update as soon as it is announced. Just I'd like to say thanks to Becky for her time today, and also thanks to everybody who's attended. I hope you found it useful. We will be hosting another webinar next week about contracts and cash flow and payments. Details of that will be on the website and on social media very soon. So thank you very much for your time, and have a good day.